Well, right now we are almost post-mask mandates, I should say. Cities are primarily returning back to normal after COVID or during, this vaccine phase. There's a lot of options out there for people to get vaccinated, to go back to work. COVID kind of slowed the pace down in the world. In our office, we have a doorbell. You have to ring the doorbell before we let you in. We take your temperature and go through the whole entire COVID screen type thing briefly. On our COVID screen, we do ask if they're vaccinated. We don't judge if somebody is or isn't. It's not about politics for us. It's more because we still have other patients in here, elderly patients. It's about simply honoring and being truthful and thinking of others' welfare.
I want to show the case, and then we will show what she wrote. And this is kind of today's topic. So, wow, what is this here? Look at my day today. Eddie is on time. Team meeting, we need to have next team meeting, and then we will talk about this. So find me a new next team meeting. What is that?
Okay. Tomorrow, next week.
So we see here a patient, you can see here missing tooth in the front. There's a young lady, she was then 19 years old or so, and there was an accident, and you can see that the front tooth is missing. Here's the missing tooth, and here this is one tooth which was also fractured, as you see, and must have some time already elapsed because you see infection beginning to occur, inflammation, infection, because the nerve is dead, so bacteria is migrating and releasing toxins in the bone, and then now the body reacts to this and creates here immune system cells which replace bone. Here this is just same day, but you can see here this is the missing tooth which was expelled, and then that tooth was fractured, here that tooth was fractured, and there is also a problem. So apparently those two teeth were then not vital anymore, so the nerve was dead. So here we see the situation, the missing tooth. Here you can see the fracture, the missing tooth again. So for a young person, 19 years old child, quite a situation. And this was August 2010. 1 month later, still was not taken care of. And apparently there was a problem, I guess, with finding dentists, financials. 1 month later already we see this situation increased, infection increased, the gaps here. One can see the shadow went to a bigger. Now she has here somebody made for her like a temporary. And we can see, as predicted, he is also already beginning to have an apical periodontitis, it's called, so chronic inflammation. So we did here, did the root canal treatment. This is one of the faces. And then we placed here an implant. So you can see here, you can see this already filled. So this, the implant is already in place. The filling looks good, this little overfill, but that's normal. It will be resorbing later. This is not to avoid sometimes. So then this here is now 1 year, almost 1 year later. So 11 year later after it happened. And now you can see here we did the prep work. We were able to save those teeth. We placed an implant, replaced this. This is then the result, I think, considering the situation. So this is really a nice result.
When we got a bad review, which is not very often, we have had 3 of them over the course of many, many years. So when I saw this review, I looked it up. I wanted to see the chart record, the case, what was going on here, to see if there's anything we can do to rectify this situation. We take that stuff very seriously. We definitely always try to give our patients the best care we can possibly give them. We haven't even seen this patient in 9 years. Not only have we not seen them, they came to us with a tooth that was missing, and we fixed it. Some dentists do better work than other dentists, So I want to see. In this case, though, I was pleasantly surprised and very happy to see that the shade was completely perfect. And I have an eye for shades. I'm a very meticulous, detailed person. The shade was dead on. The shape of the tooth was great. And I was pretty impressed, like, yay, Dr. T did a great job on this crown. It looks great, like textbook. Clinically, shape, size, everything.
A couple days ago, I found a review from this patient. I had to argue with this dentist to get crowns that matched the color of my other real white teeth. I was told Americans worry too much about the color of their teeth. Now, a few years later, I've literally been afraid to go to a new dentist since this man treated me strictly as a set of teeth and not a human being. A new dentist shows my crowns and shaped poorly, and my root canals are not deep enough to last. I now have an infection in one of the root canals done here. It appears my root canals were never done correctly to begin with. I feel that Dr. T just wanted to be able to give me more implants down the road versus giving me quality tooth repair options outside of initial implants. I know two others besides myself who went here and are now having to get further dental work done on the same teeth due to poor workmanship here in this office. Customer beware. To say publicly something that we intentionally do bad work to place more implants later, this is just unbelievable. Considering how she came in with a fractured tooth in front of her face. For 4 months, they couldn't find anyone who would have taken them because it is a very difficult situation. 11 years later, suddenly she writes such a review.
People don't realize that when you have dental work done, you still have to care for your teeth, whether it's an implant, whether it's a natural tooth, if it's a crown, a bridge, whatever, you still have to floss, you still have to get those teeth cleaned. And if you don't do that, you're going to get decay, or there might be something wrong with the bone because you are not taking care of the work. These things are meant to last a certain general frame of time. It is possible over 10 years, 20 years, you may have to have something replaced. That is totally normal. It's not any different than, let's say you have a car and tires. There's normal wear and tear.
Mark, so make please a note here. Patient likes to have smaller front teeth from canine to canine.
Okay.
Smaller.
Yes.
Number
On
one.
Top and bottom?
No, just the upper. From canine to canine. So 6'11", smaller teeth, number one. Number two, thin out as much as possible the labial plate in the max. I do not have to be embarrassed of anything I did. I always have good intentions and try to do my best. As I say here, you can see, how many points were very good and some points were not 100%. But to write such a review, so this is just unbelievable. We are working, this is our life, it's my profession, and many, many others are this way. And this shows like this digital fascism, which is now here normal. There must be regulations who make those who write something more responsible, and they have to answer to this. This is my kind of approach. Через 2 недели.
Через 2 недели?
Да, я хочу подождать, пока оно заживет. Да, тогда мы это вот.
Хорошо.
Lisa, I need him in 2 weeks. We did post-operative suture removal in 2 weeks for debridement on the right side.
Perfect.
Left side. No, right side.
The right side.